national study, we found the national water looks the same, and so all of the birth defects for the whole U.S. increase in women who conceive in the time of highest pesticide concentrations. Now, the astonishing part of this slide is not the findings of the slide, it's that I was the first one to do it. We have an entire Center for Disease Control that could have easily asked this question. In fact, I think somebody in kindergarten could have asked this question. That was the part that upset me the most. By the way, this study was refused by the Environmental Health Perspectives Journal, but thankfully the Scandinavians were willing. So these are the kids that I take care of every day, and what we now know is that the risk of having a child, that yes, we can do surgery on her lip, we can't do much about trisomy 21, but we do have very expensive clinics that they can attend, and we can repair their tracheoesophageal fistulas and their heart defects. But wouldn't it be better if they didn't happen? And here are the 22 categories of birth defects. These 11 are significantly increased in those numbers. I will point out that the other 11 were not significantly different. Now, some investigators prefer that we report these as negatives. In other words, there is no risk of increased risk of these other disorders. But if you'll notice, every one of these numbers except one is bigger than this number. Every one of them. And the reason our study was successful is that we had 50 million babies to study. If we had 100 million babies, these probably would all become significant too. So what is the question? Birth defects happen at increased risk during the time of conception when pesticides are highest. What about location? Well, we took the best guess as to your pesticide exposure using the USDA pesticide exposure data, and we found that birth defects are highest in, I'm sorry, I skipped right past that, highest in, basically we find that the counties with the highest pesticide rates have the highest birth defect rates. Since then, one of my colleagues up at Purdue has found that if you just do a satellite view of where you conceived your child, the closer you are to a cornfield, the more likely you are to have a birth defect. Preterm birth is next. This is actually, if you take all the diseases linked to preterm birth, it is even more dangerous than birth defects because it's more common. It's increasing in an epidemic manner in the U.S. By the way, why don't we all know this? This is by far the most important fact of human health that I can think of. It determines the outcome of our human race, and it's epidemic. So we took the California database, which is the best evidence or best recording of how much pesticide exposure you might have had. As you know, the California pesticide usage is gargantuan, and we found that prematurity rates, if you control for other variables, goes up directly with the amount of pounds per person or per acre of pesticides that are used in your county. Now when we presented this last year, one of the audience asked, is this really true? And I said, well, the U.S. government is actually funding a study in California that showed that when you measure pesticides in pregnant women, the ones with the highest levels have the shortest gestations. But the authors of this study felt that this finding was not important and spun it that way in the literature. Well, not important to whom? Now, fortunately, they also went further, and this is really helpful for you understanding. Why do some people get exposed and not have problems and others exposed and have problems? It turns out that what we really have is not genes for prematurity. We have genes for detoxifying our womb. And some of us are better at it than others. The para-oxidase polymorphisms can determine which of those you are. As a pregnant mother, are you a good detoxifier, which would be here, or are you a bad detoxifier, which is here? Those with the bad detoxifier version of the genes are much more likely to have premature babies. Birth weight is our final item, and we are going to be reporting on this next month. Again, in California, we preface this by saying that the newest development and newest reported findings are that there's an epidemic not just of preterm birth, but of relative smaller babies. It turns out over the last 15 years, American babies are getting smaller. Now, those of you who are dieting right now might think that's a good thing, but those of us in the area of neonatal medicine know that the size of the baby is the best predictor of brain size and ultimately your lifetime risk of being on welfare, having a job, and having major diseases of the heart and so on. So it's not a good thing. It's happening not just in term babies, but also in preterm babies, that babies are getting smaller. And so in California, once again with pesticide exposures, we find the pesticides peaking, as they do nationwide, in the middle of the summer, and the baby's birth rates, which reach the second trimester, have the lowest rates in those months. This was found whether we measure their birth weight, their relative birth weight, or their Z-score. And so we can say that if your baby was reaching the second trimester just in May and July, you're much more likely to have a smaller baby. This, interestingly enough, in California is the same time period of exposure that increases your risk of having an autistic child. So in summary, we could say that growth restriction is another risk factor for having small babies. And then finally, we did find that I-STEP scores, as Warren pointed out, were lowest in the pesticide peak months in Indiana. We went further to ask, what about children that are identified as having learning disabilities? Those are more likely to be conceived in those same months. So that's our final statement on the subject. Perhaps we should be worried, and I hope I can do that.